I'm
good.
Arthur Thevathasan from the Florey Institute at the University of Melbourne and the Austin Health. And yeah, together with my collaborators and my co-investigators, we're very grateful for this funding that Brain Foundation has given us. Essential tremor is actually a really common neurological disease. It affects 1 in 5 of us above the age of 65. It's not under the spectrum of what we see as neurodegenerative diseases, and it used to be called benign essential tremor. But we certainly know that it's actually more than benign because for a lot of patients, this tremor that can progress typically in their older stages can be quite debilitating in terms of its impact on their on their daily activities, their independence. It can often cause significant burdens of care as well to them as well. And so overall, this tremor condition, which we don't know too much about, is a functionally debilitating condition that affects a number of us. So we know that with patients with essential tremor, some patients choose to have a severe enough tremor and impacts their quality of life enough that they choose to undergo a life-changing procedure called MRI-guided focused ultrasound. And with this focused ultrasound, it's fast becoming sort of the gold standard of managing your tremor on one side. And whilst the outcome can be incredible, where a severe tremor can result in sort of almost a complete abatement of that tremor, we don't actually know a lot about the brain changes that occurs after that and the long-term changes that occur after that procedure. So sometimes patients, while they can have an immediately really good response, over time there's a bit of a rebound that comes back, and typically that sort of settles at about 3 or 12 months. And so this is where we come in as a very specific sort of targeted question as a pilot study with the research as well. But we would like to focus on this rebound and understand it a bit more. And this is where we're using very targeted, personalized, advanced neuroimaging. So we basically have fancy techniques of looking at an individual's brain network and fibers that are very specific to that individual. And we're able to understand, why do some people get this rebound? Why do others have a really good long-term outcome? And we're hoping that the results of that not only helps us practically improve the sort of the planning or the targeting and to help patients have a better outcome from MRI-guided focused ultrasound, but also just to understand even patients who don't have MRI-guided focused ultrasound, just with those with essential tremor, what sort of causes a sort of worsening propagation of tremors as well. So I think the key here is that we're using this very novel new imaging technique in an otherwise quite a well-studied problem of essential tremor. Essential tremor is a very common brain disorder, even though we don't commonly see it in hospital. But again, it affects the problem is there because it affects about 1 in 5 people above the age of 65, obviously in varying degrees of severity. So some of those are severe enough that it affects independence, it affects quality of life. There's a significant cost burden to the carers, to the person themselves, and as a sort of opportunity cost to their lost productivity as well. And so for this select group of people, I think we were really hoping to sort of improve their quality of life, and something we constantly see when we perform our procedure, MRI-guided focused ultrasound, along with a lot of other teams. These patients' lives are transformed, and the vast majority of them are transformed. And I think if we can we're seeking to optimize and give them the best possible return of their quality of life that we can. And so that's the problem that we're trying to address just on face value. But on a deeper level, because we're using this advanced neuroimaging technique and why it's important, I think we're hoping to shed further light onto, the tracks, or I should say the specific nerve bundles that are involved in essential tremor. We know roughly in general what's caused with it, but I didn't give you a very good answer before about what essential tremor is, because fact of the matter is it's a collection of tremors, or it's a syndrome. It's a collection of symptoms that sort of presents with this. We don't actually have a good explanation of why some people get it really badly and why others don't. And so this is the start of something. We're not expecting to completely solve it with this, but it's a start. It's a pilot study, which we're again very grateful for Brain Foundation for sort of kickstarting this particular imaging technique into essential tremor. So I think that's the sort of the larger scale that we're hoping to just shed light on.